Welcome to the Panic Button. I'm Nina.
I'm Jessie.
Today we're reacting to Dr. Phil. He has a whistleblower on from a Texas gender clinic, and he gives us some insight on what's actually going on in these gender clinics.
Interesting.
Interesting indeed.
A ban on gender-affirming medical care for transgender youth went into effect in Texas today, making it the most populous state to date with such a ban. An estimated 30,000 young people in Texas between the ages of 13 and 17 identify as transgender. The new law revokes the medical licenses of any doctor who provides minors with gender-affirming medical care.
22 states have laws on the books that ban some form of gender-affirming care for transgender minors, meaning they either ban puberty blockers, hormone treatments, or surgeries, or all three.
Without getting this medication, I will go through the wrong puberty, making permanent changes to me that I do not want.
I have studied the research, and there is no other instance where a medical profession has proceeded with little or no evidence showing whether or not these hormonal treatments are safe long-term. And these treatments certainly are not reversible. That's exactly why our guest tonight, Dr. Anton Heim, says he blew the whistle on Texas Children's Hospital. Dr. Heim made major headlines after claiming the hospital was secretly performing these procedures on children as young as 11.
I thought, maybe this is my mistake, but I thought we had to get drugs approved before we could start giving them to everybody.
The puberty blockers are approved drugs.
But for people with precocious puberty.
Yeah,
These kids don't have precocious puberty.
right.
So how can you use a drug for the wrong purpose?
It's experimental. That's why.
But they're not signing it as experimental. They're saying that this is guaranteed not going to go back.
I know. They're lying. They're lying.
So how do they get away with it?
Power. They have the power. They have the numbers of people backing them.
What the child was saying in the beginning of the video. There's going to be permanent changes that happen to me that I do not want.
You don't even know about.
There are worse permanent changes that happen from blocking puberty than there are that happen from allowing a soon-to-be transgender, transsexual person from going through puberty. There's a worse outcome if you block their puberty than if you let them go through it and then go through the bottom surgery, etc. later.
The largest children's hospital in the world issued a statement publicly, unequivocally stating they were going to shut down their transgender program. But it was very soon after that I found out this was categorically untrue. People would tell me about how they were implanting these puberty blocking devices into 11, 12, 13-year-old kids. They told me about how these kids had all these psychiatric issues that were going unmanaged and just being attributed to this one thing. As a doctor, you have a responsibility to take care of patients. And you go into medicine because you want to do that. You want to protect patients from the diseases that affect them. But you never imagine that you have to protect these patients from the hospitals.
Did they stop?
So they did not. And the reason I knew that because I worked there. They were giving conferences where they were talking about concealing it from the public. If you're not willing to defend what you're doing to those people in the public eye, then it's very likely you're doing something very, very wrong.
I did medical studies, but you have to sign off on it. You know you're doing a study. You know you're doing something experimental.
Yeah.
You know what I mean? And no one's saying this is a transgender study. You know, we're studying the effects of doing puberty blockers. You know, no one's saying that. I'm not hearing that out of any hospital. I'm not hearing that out of any institution. So how do you trust your doctors?
How do you trust anything? I searched on Google today about puberty blockers, and even when I searched puberty blockers, like irreversible, I couldn't find anything about the negative side effects of puberty blockers. Nothing. Everything said it was reversible, safe. Google it.
Meanwhile,
Google it now. They hide the information.
Yeah, Google especially. Everyone knows that.
Intentionally. All this information is coming out that they're not safe, and Google is just suppressing all the information. So people are like, well, it must be safe because Google.
Well, you know why else Google suppresses it? Is because they're probably getting money to say that, oh, it's fine. It's fine.
Yeah. It's
all the
not
sponsored
fine.
ads, all the sponsored ads for why you should go on puberty blockers come up before why you shouldn't.
And then this is going to have a horrible effect.
Well, and that's the thing is every other commercial you see for any drug, you hear all the negative side effects. It doesn't seem like they're telling any of these kids the negative side effects. And even the ones who are trying to are being dismissed.
It's like a cure-all for all your mental issues. We could fix your depression, your anxiety, and your gender dysphoria all at once. with transition
What does this
by
have to?
Pfizer.
What does this have to say with your safety in hospitals, though?
It doesn't. You can't even go into a hospital and not know, are like men who think they're women going to be in the maternity ward, or are they going to be next to us in a fucking hospital when I just want a roommate who's a woman or a nurse who's a woman?
Imagine having to be in the ICU and your roommate is a trans woman.
You mean a man?
Yeah, but I'm just saying. It also makes it so you can't trust your doctors. You don't know that they're going out for your benefit. You know, they could be going just for money. Say you have a minor heart issue and they could say, go on a diet. Instead, they'll be like, here's some blood pressure medication so I get more money in my pocket.
That's why you have to do your due diligence and do the research and not Google.
Make sure you have doctors you can trust.
Yeah, always look at the opposing side just in case.
Get a second opinion if you really need to.
And you believe that the information that you released may have influenced the passing of State Bill 14, which raises the age to 18 for children to be able to receive this.
I think so. Yeah.
A Democratic State Representative, Sean Theory, voted for the bill, and this video of her has gotten 2.3 million views on social media. Take a look.
Members, it is out of respect, caring, and friendship for every member of this body that I would like to share my position on this very complex issue. I am making a decision to place the safety and well-being of all young people over the comfort of political expediency. It is my core belief and conclusion that we should remain consistent in the premise that children must be given special provisions under the law, as they cannot fully appreciate the long-term consequences of their actions. As such, the best practice should be to raise the age to 18 for gender modification. Moving forward with this prudent policy, we should also ensure that vulnerable children and teenagers have quality access to mental health care that is safe and in a supportive environment. Only by taking a careful, compassionate, and evidence-based approach to this issue can we guarantee that we are doing what is truly in the best interest of our children.
So we need to stop affirming, because that's not mental health therapy at all. Affirming is not mental health therapy. That's something else. That's like that holistic, guru, culty, hippy-dippy kind of shit.
Yeah, what she's saying is we have a bunch of other laws that say that people under 18 cannot fully understand their actions.
Yep.
And need guidance in doing most things.
Can't make adult decisions.
You can't even use scissors if you're not a certain age, like at your job.
Yep.
I think it's like 17, 18. You can't use scissors till then. At least in our state.
Can't see a rated R movie if you're under a certain age.
And it's insane to think that these children who have so many comorbidities, how do you know that this gender dysmorphia or whatever?
Dysphoria.
Yeah. How do you know that that gender dysphoria isn't caused by depression or anxiety or any mental health comorbidities they may have? You don't know. And so we need genuinely good mental health providers to ask kids how they're feeling. We've admitted it. There's obviously some transsexual people out there who are happier being transsexual. But we can't just let everyone be transsexual, and we especially cannot let kids who don't understand what they're going to be in 2 years, let alone a year from now, change their gender. Would you know what you were going to be when you grew up?
Fuck no.
Exactly. How would you know if you want to change your gender?
You don't. That's why it's so retarded when adults are like, well, they know themselves. You just want to, like, I don't know whether to slap them or like, check them into a psych ward, because you're literally telling me that your child doesn't need a parent or an adult in the room because they know better. That's crazy.
It's wild.
I was working in a pediatric gender center for 4.5 years, primarily responsible for patient intakes. The center followed this message that transition would solve everything. There were very few written protocols or guidelines. One of the providers even said we were flying the plane as we built it. Doctors are acting like they're God when it comes to medically transitioning children. Children could identify themselves as transgender, see a therapist for one visit, see our endocrinologist for one visit, and end up with hormones that would impact and change their bodies for their lifetime. These were identities that were still shifting and changing, but the treatments were irreversible and permanent. I saw a young person who was begging to have their breasts put back on after having surgery. We were encouraged not to make a big deal out of it, and definitely not to tell other families. I was told I could no longer raise concerns or even use the phrase, I have concerns about a patient.
You describe yourself as a queer woman married to a transgender man.
Yes.
So lesbians.
That's,
I
I guess,
hate that word queer.
That's, I guess, where they throw queer in where it's like, I'm a lesbian, but I don't want to disrespect because, like, okay.
I don't want to disrespect my partner's identity, so
but
you're
you have
erasing the word.
You have to realize that she's obviously woke. She's freshly unwoke.
Yeah.
You got to give him a second to unwokeify. But yes, she's just a lesbian with a woman who pretends to be a man.
The TQ, etc. erases the LGB. How is nobody being like, this is fucked up?
Even when I dated that one person who said they were maybe like this or that, I never said I was a queer person. I said I was a lesbian the whole time.
No, because queer is part of trans.
Right.
Okay? Just like non-binary is somehow a part of trans too.
No, because I'll still call myself a lesbian because I still like pussy. Why would I call myself anything else? You know what I mean? That's where this queer person thing comes from. But doesn't that diminish you as a lesbian?
Yes.
By calling yourself a queer person and then giving this other person trans man is I'm just a simple queer person and they're trans man.
Yeah, see, we had the LGB transsexuals, right? But then queer ideology was like, hey guys, time to put some stuff up. Came in, wiggled its way in, and decided it was like a virus. It infected the whole acronym.
I always thought Q meant questioning.
Yeah, me too.
And I like that better. Because it makes more sense, doesn't it?
I guess it would make more sense.
Gay, bisexual.
And I don't know what the fuck I am.
Transgender because they usually have gay sex.
No, transgender doesn't make any sense.
Transsexual. My bad. So it's lesbian, gay, bisexual,
but then you have to add,
transsexual.
AGP is part of the transsexuals. And I am for the AGPs.
I'm explaining what I thought. Hang on.
Okay.
It was lesbian, gay, bisexual, transsexual, questioning. Because you don't know if you like one or the other if you're straight. So that made sense to me. The whole QIA plus two spirit, amen, that I don't understand.
No.
Because even when it was LGBTQA, because that was a thing for a while, I knew of it, but it was supposed to be lesbian, gay, bisexual, transsexual, questioning alliance. So you were an ally then if you were straight.
I don't want allies in our acronym.
But it made more sense.
They don't belong.
Now it stands for asexual, which is a completely different thing. Everything else involves some form of sex, and then all of a sudden, no sex.
Yeah. Once we get into the T's, that's where we lose all hope. If you're a biologically born woman and you're a lesbian, and then you transition to be a man, now you're no longer a lesbian, now you're straight.
But then your partner's queer.
So you just erase lesbian.
Mm-hmm.
It's like, well, fuck me.
That's what this person just said.
Yeah.
You're a member of the LGBTQ community, and you went there to do something good, something positive at this clinic in St. Louis. What changed your mind?
A number of things. We started to see patients who were experiencing very significant medical harms, being rushed to the emergency room with lacerations requiring stitches. We had patients contact us who were begging to have body parts put back on within months of having surgeries. And the thing that kept happening is every time I would raise concerns and ask about the protocols and ask about the guidelines, this is just how the industry works. If a child says they're trans, there's no questioning it. We just say, yeah, you're trans. What would you like?
You're telling me that a 12 or 13-year-old who can't decide which pajamas to wear can come in and say, I've decided that I want to transition, and with no more than a couple of hours or 2 visits, not even a couple of hours, 2 visits, they say, okay, start taking this, start doing this, which alters their biochemistry in a way that you can't come back from.
Correct.
And you say you saw dramatic increases in teenage girls that had no previous history of gender distress, and they suddenly declared themselves transgender and demanded immediate testosterone blockers.
Yeah, when I started, so I was there for 4.5 years. When I started, I maybe would have 5 to...
Oh, we got it the same
Gay
thing.
woman.
We both looked.
Well.
It's not wrong.
Oh.
It's not wrong.
10 new incoming patients a month. By the time I left, it was close to 50 every single month. My background is in clinical research, and so I started looking at the data. I wanted to know what the numbers told me. And towards the end of my tenure, 73% of the new patients coming to us were girls who were in their teen years. So in that really vulnerable age of like 13 to 16, where they are just exposed to so many social pressures, and they're so empathetic to what's going on around them too, that they really pick up on what's going on in their peer group. We had clusters where it would be a handful of one whole high school classroom would come in all trans-identified.
Historically, this typically would be males.
Yeah.
And
It's not a social contagion, though. We're not transing the gay away. We're not getting rid of tomboys and making them boys.
Well, some of those girls aren't even trans. Some of those girls aren't even gay girls. They're just confused.
Yeah.
They're confused about who they are. They're upset because they'll never have the power that a man has, just like physically speaking, socially speaking.
But
so they're transitioning because their friends are doing it.
Yeah.
They think it'll give them power, and they think it's gonna change their lives for the better.
Right. Okay.
But they don't realize that sometimes they like being girls.
Well, see, if they transition, they're little girls, right?
Yeah.
Little girl is transitioning into be a boy, which means he has to enter boy spaces.
They're ending
That's-
middle school and going into high school at
that's-
that age.
Right. That ain't safe for a girl to be going on into guys' locker rooms and guys' bathrooms. That's not safe for them. They think that they're going to gain some sort of, I don't know, safety or power because they won't be
Both.
looked at as sexualized, but I'm sorry. They're going to look at you either as a girl or a frail, small gay guy, and you're still going to be targeted
Yes.
in male spaces. It's
Some-
not safe for women.
Some of them I don't
Not
think
for
even
girls.
care about being sexualized as much as they feel about having an unfair advantage in life. They feel like
Maybe.
because they're women, they're inherently set off on a worse path than a man. And I can say from I'm sure you felt that way at one point in your life, that men have more power, men have more opportunities, men
Yeah.
have more success, and men, have
can
it better.
actually relax.
Right.
Women, we always have to be on guard if we're out in public.
And so,
you know,
and so I can see completely why a woman of any state would say, man, it'd be nice to be a dude. But it doesn't change the fact that you're still a woman.
yeah, but just because you think it'll be nice doesn't mean that when it actually happens,
Maybe
the
in a
transition, doesn't mean that you're gonna actually like it or be safe for that matter.
That's
Not
why-
unless you look like Buck.
That's why I say maybe in a different life. Man. I mean, that's literally like all I can say is maybe in a different life you'll know what it feels like, but not this one.
But then, what kind of mental issues are you going through? You're going through some other mental issues in order to have this thought that you need to be a guy. So what is it? What's going on?
Maybe not necessarily.
Really? If you hate your body, that's a body issue.
No, not. You said if you feel like you need to be a guy. I'm thinking more of if you feel like the desire at all to want to be a guy. I think that's a normal woman feeling. Like every woman at one point or another has been like, man, it'd be easier if I was a dude.
Yeah,
The
but we don't go
difference-
to therapy to get the puberty blockers. And
The
stuff.
difference is the people who go through with it to transition.
Yeah, but when you see everything on the internet
You're convinced you
saying,
can.
saying
Yeah.
it's a thumbs up, you get affirmed puberty blockers.
We'll think
and
you're a man.
soon, testosterone.
Yeah, no, it makes sense to why they think that
It's
way.
not a quick fix. You're still
But
going to be
it's
messed up
being-
in the head.
But it's being brought off as a quick fix. And if everyone you know is telling you that's your problem, it'll fix everything, of course at 14, at 13, at 12, you're going to buy it.
But doesn't it make you wonder, well, if everything else has side effects, why doesn't this? Why is no one saying anything about the side effects? Shouldn't that concern you? Anybody?
The 11, 12, 13-year-olds, they're not thinking about side effects.
Which is why they shouldn't be taking this shit.
Exactly.
You would have a female how often?
Oh, very rare. And also the ages were different. So it would usually be younger boys who seemed very feminine or had feminine traits to their family, and their families would seek care, trying to understand what was going on for their young male child. This was never something that would start in adolescence. And these girls were also learning on TikTok, Instagram. They would come in and they would almost have the exact same storyline too. Like they learned what to say from a video to explain, oh no, really, I've felt this way from early childhood, but a lot of their parents couldn't remember anything like that. And part of what's going on right now is that if you question this at all, you are immediately called transphobic, you're immediately called homophobic, you're immediately considered a bigot, and it's just not scientific reality.
Well, glad I don't give a about being called bigot, transphobe, homophobe. Ooh.
But I think
we learned. I don't know if you guys learned this when you guys were in school.
sticks and stones may break my bones.
Did you learn it?
No, I'm saying it because I don't know what the you're talking about.
Well, I learned it. I know you didn't, but that's okay. I learned it. And what we learned was that words can't hurt you unless you let them. Right? So
Isn't that what I was just getting into?
Yes. So why is it like it's not, it's like backwards now? Words can hurt you, force other people to speak the way you want them to speak.
You want people, not you necessarily, because you're different.
Yeah.
But in general, most people want to be likable, easygoing, and non-problematic. You know, like, just get through life.
They're not easygoing, and they're very problematic.
I said in general,
Okay.
not these people.
It's ma'am.
Not these people, but I said in general people. Like,
Okay,
like
yeah.
you, me,
Yeah, oh, yeah.
Susie down the street.
Okay, yeah.
She doesn't want to start problems with you.
Okay.
If she's walking down the street while you're walking down the street, she's not going to be like, hey, bitch, pick up your trash. You know what I mean? She'll wave at
might.
you. No, but like Susie down the street will just wave at you and walk on by, right?
Yeah.
Because she doesn't want to start a problem.
Okay.
She just wants to move on with her day. And so she'll be like, to seem nice and not start a problem. But people like this aren't like that. And so they get hurt by words. So they use words to try and hurt other people.
But it doesn't work because that's the thing, is that we have like actual self-esteem and we're like secure in who we are. So words don't hurt us. So it's even sadder that they're trying to throw stuff at us verbally that they think will hurt us because it hurts them. When really they're the one with the issues.
It's their only line of defense. Like, it's the only thing they can do. Because they know they're wrong. They don't have facts to prove they're right, so they just yell. And it's sad because most people don't want to be bigoted toward this. These people are working in that field.
Mm-hmm.
They were literally working with these patients. The woman is married to a trans guy, so she probably went into it thinking, you can't say trans woman because that's wrong.
I said a woman. She's
Yes,
married to a woman.
A woman. Someone who's
she's a
biologically
man.
female. But my point with that is that she probably went into this field thinking, I'm going to help people like my spouse. Mm-hmm. You know, so good intended. Like good intentions, but saw this kind of thing and finally spoke up because unfortunately, as much as people don't want to be called negative things, they have to speak up at a certain point. So now she doesn't care if people call her a bigot because she's doing it for the right reasons.
Well, I think she still cares. I mean, she calls herself queer.
I don't think, sure. But
Usually people who call themselves queer, like you said, are woke. And if they're woke, they're usually, ooh, I'm afraid
I don't think
to
she's
say
as
the bad
concerned.
thing.
I don't think she's as concerned
that makes more
now
sense.
about being called a bigot because she knows that she would have probably called herself a bigot.
Yes.
And so she's like, yeah, that's how I was before the change.
Transphobe just means anyone who doesn't buy into the bullshit queer ideology,
Well, she learned that.
gender ideology.
She learned what that is because she was told not to give her opinion anymore and not to be concerned about people. So,
Well, isn't that why I got into this in the first place?
Well,
to be
'cause-
concerned about people?
right, because she cared about one person who identified as trans, so she was trying to
No,
help.
you don't care about them.
Right.
That makes no sense.
It doesn't make any sense whatsoever,
Shouldn't
especially
I care?
like considering everything that we know about her just from what we learned in
Yeah.
the short video.
Yeah.
It doesn't seem like the case with her. It's like telling someone that's in education not to care about the test scores of the children.
Yeah.
No?
I was agreeing with you.
Do you think I'm right?
I think you're right.
Yeah, because it's like, don't worry about how they perform. Just keep going. Am I a babysitter or am I a teacher? Like, what they're doing that. in the education system, that's happening too. That's why a lot of kids are illiterate these days.
Oh.
Because they
Yeah.
just pass them on, pass them on,
They're
pass
not
them on.
learning their ABCs. They're learning their LGBTQ. Blah blah.
A plus I.
Yeah.
Two spirit.
I know the acronym
Amen.
inside and out, but what comes after F?
We go back to A. It's the musical scale.
Like and G. Like and
Damn it.
subscribe.
I'm tired. Take me home.
Join our
Yes.
memberships for early access to our videos, and you can send us a super thanks. You can send us a super thanks if you want to. Bye, y'all.